Mixed reality is everywhere. AI is everywhere, surgical planning. So I feel today that we are living a momentum, digital momentum in surgery, and that I can tell you it wasn't at all the case 10 years ago.
Virtual reality, augmented reality, wearable AI. If you're a gamer, you know exactly what I'm talking about. Gaming technology is now allowing surgeons to operate more efficiently and with greater precision. That's the topic we're going to dive into on this episode of Tomorrow's Cure, a podcast from Mayo Clinic that brings the future of medicine to the present. I'm Kathy Wurzer. I'm glad you're with us. Today on the podcast, I'm joined by two guests who have leveled up in their pursuit of surgical innovation. We are so pleased that Dr. Joaquin Sanchez-Sotelo is with us. He's the division chair of shoulder and elbow surgery at Mayo Clinic. He performed the first ever mixed reality navigated shoulder replacement surgery in the U.S. Now, in the interest of transparency, you should know that Dr. Sanchez-Sotelo is a consultant for Stryker Trauma and Extremities. That's a medical tech company, and that's a consultancy through Mayo Clinic. Also with us is a leader with Stryker, Jean Chaoui. Mr. Chaoui is Vice President of Clinical Applications and Solutions, Digital, Robotics and Enabling Technologies at Stryker. He has developed a system to create 3D patient-specific models of parts of the body that can be viewed and manipulated by doctors with VR headsets during surgery. That's a lot. It's going to be an exciting conversation. I'm so glad that both of you are with us. Thank you for joining us.
Thank you for hosting us.
Thank you.
Now, I was doing some reading prior to our conversation, doctor, and I understand that shoulder surgeries are the second most common orthopedic procedure after knee surgeries. And there are usually multiple corrective surgeries before the problem is fully fixed. I'm curious, why is the shoulder so delicate?
Yeah, the shoulder joint is a very interesting structure. It's very complex. And especially in North America, where individuals have interest in upper extremity involved sports like basketball or baseball or tennis, some individuals that practice those sports that get an injury, or individuals that enjoy weightlifting will overload the shoulder. So that's one category of patients. But more commonly, Kathy, to be honest, is the patients that have what we would call wear and tear of the joints. And that comes in two categories. In some individuals, what fails or wears out is the joint surface. And we use the term plain arthritis for those. In some others, what happens is that the muscles of the shoulder that we call the rotator cuff tear, and if they keep tearing more and more and more, eventually the joint has secondary degeneration.
So who is a good candidate for shoulder surgery?
For shoulder replacement, it will be the patient that has reached a point where the degeneration of the joint is such that pain, loss of motion, loss of strength, and loss of function in the end compromises substantially quality of life and daycare activities.
I think we should probably tell our listeners when we start talking about MR, VR, AR, what are those definitions? Jean, what are they?
Yeah, sure. So, great question. Today, extended reality is the umbrella term that covers augmented reality, virtual reality, and mixed reality. So, virtual reality, it's very simple. It's when we speak about a fully simulated environment. Everything is created by, the computer. Augmented reality is you start with the real environment, and then you can project additional elements, 3D models, additional information on the device. So this is what we call augmented reality. Then mixed reality, it's a mix of both. So you have the digital side of the environment, you have virtual objects, digital information, but also you would still have the real environment or real components in that environment. So this is briefly those three terms.
What spurred the development of AR and VR models, especially for shoulder surgery?
Yeah, so actually the evolution of the 3D rendering, the 3D visualization, plus the compute power that also evolved recently. And putting all of that on one device, which is the headset, And then you can project 3D information, you can leverage connectivity, and you add on the top of that artificial intelligence. So all those four elements together, we get to the best time where we can leverage when we build 3D anatomical models from the imaging, like CT scan. Now we can project them on such devices.
Do you recall your reaction, doctor, when you first heard about this technology and how different it is versus how you were trained?
Kathy, so when I was in training, all we used was plain X-rays. And that makes the surgery difficult because in your mind, you have to try to understand how that X-ray projection of a patient translates into the surgical field. All of a sudden, Jean Chaoui and his team developed a way to get CT scans and get models that you can see in a screen virtually, but it's still a screen. Now it's actually projected to your eyes in real time in front of a patient. And then one step further, you can now tell the computer where that patient's bones are to make the surgery very accurate, because in joint replacement in general, for the hip and knee or the shoulder that you talked about before, getting the parts where they belong is extremely important for function and longevity.
How would you describe this to the layperson? Is it almost like having the surgeon has almost like X-ray vision in a sense by combining the computer-generated images with the real-life visuals?
The way I tell my patients is almost like as I can see through your skin. So I look at your body, I can look at your bones, and then there is a digital replica of your skeleton I can place by. But beyond that, I can tell the computer where is your bone in space, and that will allow me to place the parts, the prosthesis, or the components of the replacement exactly where they belong.
Versus the old days where you might just try to not feel your way through it, but you might have, not trial and error either, but how would you describe what you might have done in the past?
We used to eyeball where the components are supposed to fit, and we thought we were really good, and we were pretty good. But when you look with sophisticated levels of measurement about how we used to perform and how we perform today, we are orders of magnitude better thanks to technology, no question.
Also, one of the main reasons of the how impactful this technology is this tracking of the fingers, the tracking of the whole environment, but also the fingers. So it's another level of interaction that we are able to provide. In addition to the holograms and the 3D immersive visualization, we are tracking also the eyes direction. So you can look at a button or any element in the 3D environment, and then you can select it. So we use the eye tracking, we use the fingers interaction, and this is what makes the technology very disruptive to all what has been done.
So when you get the headset on for this particular application, you see a hologram, which is basically a digital object that has volume and colors with all these different numbers that will tell you what are the dimensions of the bone. And then with hand gestures, you can actually move it in a space, locate it where you want, make it smaller, make it bigger, walk around it. So it gives your brain an understanding of that patient's anatomy that is beyond anything we can have until today.
I'm curious here, Jean Chaoui, what was the aha moment for someone like you, knowing the technology as well as you do?
In our field of computer-assisted surgery and navigation, all of that started 3 decades ago. So nothing is new today. But what's new is this kind of technology. Again, when you can leverage those sensors that can track and scan the environment, the room, the patient table, the instruments, and locate them in real time without having big external cameras around the patient, all of that is head-mounted. So that was an aha moment for us, where we said maybe this is the next generation of the traditional surgical navigation system.
Do you remember the first time when you put that VR headset on? What did you think?
No, I will never forget. You feel like a little boy with a new toy. I mean, you've been looking at X-ray CT scans in just a plain monitor like watching TV. All of a sudden, you get the headset on. You can walk to the object. You can walk through the object, you can walk around it, you can move it. The experience of visualizing the patient's anatomy with MR is unparalleled. I have a great team, and they like to make fun of me a little bit. So when I walk into the OR with my headset and I look like an alien and I'm with my fingers going like this, like, oh, here he comes. But then once we get going with the real surgery, they are super respectful and they really want to learn what this is all about. So it's interesting. They see you coming to the OR and they think they're from another planet, but then everyone shapes up and everyone wants to know why is it that this technology is helping us so much with patients. So it makes surgery fun, which is a good thing because the more engaged and passionate we surgeons are, the better we take care of our patients.
Does the instrumentation feel natural? Because you still have to place the joint and whatever you're working on. Is it realistic in terms of depth perception?
Very much so, yeah. You have to make some adjustments at your workflow to some extent. This headset have a little bit of weight on it, and it occludes your view. So you have to adjust a little bit in that regard. But in terms of being able to place the holograms wherever you want and then translate your plan to the patient is very streamlined and straightforward.
Let's talk about post-op recovery, because shoulder surgery can be incredibly painful as you recover. How might this technology help patients as they recover?
Pain after surgery is mostly due to how much we have to dissect or separate the soft tissues. And as we get technology that allows us to be less invasive, surgery will become also less painful. So my dream is that one day we can do all these operations with less disruption of the tendons and the muscles. That will definitely translate in a quicker recovery.
Jean Chaoui, as you were developing this, were you thinking about that?
Of course, we believe that technologies would help a lot in several steps in this workflow. So the more we optimize the surgical planning, the more we make this planning smarter by taking into account the experience of our surgeons like Dr. Sanchez-Sotelo and others. We inject artificial intelligence to make those planning smarter. Then intraoperatively, the same thing. We try to learn and to train AI algorithms on the way how the surgeon are executing the plan intraoperatively and try to connect that with the clinical outcomes and then suggest the best surgical or the best strategic therapeutics for every case.
Doctor, you have been named Mayo's Teacher of the Year twice. So you're pretty good. You're pretty good at teaching new doctors and surgeons. And it's been said that surgeons need to perform a procedure at least 75 times to be proficient. How might this technology change how surgeons are trained?
Well, it's a complete paradigm shift, so a complete change in how we do things. Using VR, which is the virtual reality that Jean Chaoui was talking about, where you get a different type of headset that has training modules. There are studies that show that the retention rate of students, so trainees, residents, fellows, is up to 500 times more than reading the technique. The fact that I plan every case and I visualize every case, just by doing that, you become a better surgeon. You have more understanding of how each individual shoulder needs to be addressed. Then on top of that, you have a machine that tells you, place the pin here and you'll be fine.
I wonder how this then might possibly change the costs associated with medical education.
Yeah, if we speak about medical education, mixed reality is a great technology to support medical education and to bring it to the next step. We can increase the efficiency of the educational process for our students. Also think about what we call remote proctoring. So today, even for like some medical device where you need to be accompanied by a proctor, we can have a real-time transmission of what's happening in the OR, where the remote proctor could see 3D holograms and all the surgical steps happening and can comment in real time, can have the chat in real time. So this is another benefit of this technology, is all what we can do on the collaborative pillar and medical education and remote assistance.
So the ability to help another surgeon improve the skills remotely is incredible, and you don't have to spend on a plane ticket, a hotel, time of work to be able to teach other people individually when to do a procedure or as a large group.
And of course, I understand that surgeons might learn a new medical device at a workshop for a couple of days, go back home, and maybe not perform the procedure for another few months. So might this help them keep their skills sharp, in a sense?
Yeah, because with a VR training set, you could easily practice and practice and practice. And the idea one day is that you can actually import in that headset your patients for tomorrow, because now for training is like a general skeleton, but one day we can import the same patient. And then for MR, it's actually the patient you're going to be operating on tomorrow that you can practice at home so that they can be my best surgeon for them the following morning. And that's very powerful. The brain retains that image much better than if you look at an X-ray.
So I'm wondering, we've done an episode on 3D printing during this show. How might 3D printing in the OR dovetail with this technology, or are they just too separate?
So this kind of technologies, thanks to AI, again, how to go from CT, from image to implant, plus the additive manufacturing that provides us with an implant that we adapt to the patient anatomy, and we don't adapt the patient anatomy to the implant.
You use smart implants, right, to track patient outcomes post-surgery. How does that work?
So if we speak in general about smart instruments, smart implants, we speak about connectivity and data. So today, thanks to the imaging modalities, we can extract and assess the patient anatomy and the pathology. So now we speak about preoperative phase, and intraoperatively we can use mixed reality for guidance. We can use robotics also for the surgical execution of those surgeries. So we can bring the plan, execute the plan with high level of accuracy and precision. And now speaking about data and sensing and smart instruments and smart implants, we would like to cover also the post-op phase. That means what will happen after the surgery. This way we can collect the clinical outcomes. We can collect data, how the patient feels after the surgery and how the patient evolves after the surgery. So we can close the loop and optimize the surgical planning, the surgical strategy by taking into account the best clinical outcomes from the experience.
Dr. Sanchez-Sotelo, would you like to make a comment about that?
Yeah, I think what Jean Chaoui is talking about is very complementary. What's happening in orthopedic surgery, and particularly in shoulder arthroplasty, is that now companies can make implants that are patient-specific, right? And that's incredibly beneficial because, of course, you need the same technology that powers MR to plan and make the implant. Then the implant is made and it just fits that patient's anatomy perfectly.
When we talk about augmented reality in the operating room, this is sounding amazing. But have you run into any problems, any challenges, complications? What are you learning about that, if anything, Jean Chaoui?
Yeah, I can start with maybe the technical constraints and risks as any medical device and any connected device. We should think about privacy. We should think about cybersecurity. So the medical device manufacturers today, they have a good level of expertise in how to deal with those risks, how to protect, if we use this kind of device, how to protect the data and the data transferred intraoperatively and preoperatively, how we make sure that we de-identify the patient information, we stock them on the right appropriate servers, following the regulation per country. And then, of course, as any medical device, think about the safety and the efficiency of that device. So this is from technical standpoint. We have other maybe like optical also effects.
Yeah, I don't think that this technology will create its own complications. If anything, it will make us better surgeons. The worst complication is maybe that the system doesn't work. It's like when you have internet access at home, there is a massive storm, Now you don't have internet for 2 hours. So it can happen because these are, in the end, machines that they can maybe malfunction. And then what you have to do is go to your plan B, which is doing surgery like you always did it before, right? But I don't think that per se they're going to create any complications.
I'm curious, Jean Chaoui, is there still skepticism among some in the medical community about using what some people would think is gamer technology in medicine? Have you run into that?
So 10 years ago, when I started, I can tell you, yeah, the adoption was tough. The barriers of adoption were real, and they concerned navigation, planning, where the adoption rate was less than 5%. Everything changed today. Today, I feel there is no more debate about the added value of those technologies. If, of course, we think about the right case and the right application. You can see today robotics is evolving very fast. Mixed reality is everywhere. AI is everywhere, surgical planning. So I feel today that we are living a momentum, digital momentum in surgery, and that I can tell you it wasn't at all the case 10 years ago.
What about your patients? When you talk to them about this, what do they say?
You know, it's interesting. Patients are more and more savvy about technology. And especially because many patients of mine already have heard about technology in hip and knee arthroplasty, because hip and knee arthroplasty is very common too. They come to me and say, hey, you know, I heard that they're using navigation or robotics in the knee. Can you use it in the shoulder? So they actually want it, you know. And I think over time, it may be almost a requirement one day where patients may say, you know, if that doctor is not using any type of help, I'm going to choose someone else that can guarantee a better outcome because he or she is using the tools that allow him to be or her perfectionist.
Do you see this technology being used in other parts of the body, perhaps?
Yeah, sure. Sure. This technology would be used outside of the orthopedic field. Think about neurosurgery, biopsy, brain tumors, deep brain stimulation. Think about neurovascular, aneurysm, 3D visualization, and planning of, for example, stent and coil placement, and many other applications.
You know, this podcast is called Tomorrow's Cure. So I'm going to ask you both to look into the future, look into your crystal balls here. How do you envision mixed reality being a part of Tomorrow's Cure, the next frontier for this work?
So today, okay, we get this high level of rendering and visualization, immersive visualization. What we need to add is the proprioception level. This is what the surgeon also needs. They need to feel also in 3D exactly like how they are doing today. You combine all that with robotics, you get the perfect surgical planning, you get the perfect execution, and surely we get better clinical outcomes.
I think from my perspective, Kathy, what's going to happen is that all these technologies that are already very good and are complementary are going to converge. So you may read about robotics, optical navigation, smart instruments, AI, mixed reality, wearables, and they're all going to come together. And one day they will all work in synchrony to have an ecosystem of devices that talk to each other, and they all pile up to make our outcomes better.
Is there still room for the human element in all that?
Yes, no question. Yeah, I think medicine is still an art, and the most important thing for us is always the patient, and there is an element of empathy, advice, and care that is important. And also, any mechanical device can have a malfunction, and then you have to be there to first understand it happened and then realize how to overcome it. So I don't think we surgeons are going anywhere. We're just going to be augmented by augmented reality.
You know, you mentioned disruption, Jean Chaoui, and I'm curious as to, does that drive you?
To make better clinical outcomes, like this is the best motivation ever for a job, at least in my personal opinion. And then developing this, designing this with surgeons like Dr. Sanchez-Sotelo, with talented team and then see the results helping other patients, yeah, there is no better motivation than this.
And what motivates you to keep going with this?
Helping our patients. For me, like for Jean Chaoui, in the end, it's about our patients. So when you see someone come into the office 1-2 years after surgery and they tell you, oh my God, I have no pain, I can move the shoulder, I went playing golf with my friends the other day, I scored an incredible game, that is priceless. And that is what motivates me to come to work every single day. Of course, I also like technology and surgery. So on top of that, what I do every day is fun. So it's like a double satisfaction. You're doing something that you enjoy doing with your hands and all this technology that I like. And then you see that you're helping people. It's incredibly satisfactory.
Your faces, both of them, are just all lit up. So I can tell that really this is a passion for you and that you are enjoying what you're doing.
No question.
I have to say, it's been a great conversation. Thank you. Thank you so very much.
Thank you for hosting us, Kathy.
Thank you, Kathy.
Tomorrow's Cure is a co-production of Mayo Clinic and PRX. Our senior producer is Nancy Rosenbaum. Our theme was composed and produced by Terrence Bernardo, and the show is mixed by Tommy Bazarian. We had research and production support from David Newtown, Deborah Balthazar, and Genevieve Sponsler. Tony Carlson is our production manager, and our executive producer is Jocelyn Gonzalez. Be sure to follow Tomorrow's Cure on iHeart, Spotify, or wherever you get your podcasts. I'm your host, Kathy Wurzer. Thanks for listening.